Do you know there are warning signs that you can identify even 1 month before a stroke happens? This isn't a mere query, but a call to awareness. We're here to shed light on the top 10 warning signs of a stroke that could be evident a month prior. Globally, stroke is a significant health concern, with millions affected each year. Each year, approximately 15 million people suffer a stroke, of which around 5 million die, and another 5 million are left permanently disabled. Now imagine being able to recognize signs of a stroke early enough to prevent it from happening. In this video, we will reveal the top 10 warning signs of a stroke 1 month before it strikes. Listen carefully, as the information we will give you is of utmost importance. But first, before we start, please like the video, because the more people like it, the more we'll be able to get this valuable information across to people that might really need it. Your contribution may be helpful. Also, please share the video with your friends and family. Many lives can be saved with your help. Now let's discuss the 10 warning signs of a stroke to look out for. Number 1. High blood pressure. It isn't just a number on a screen, it's a major risk factor for a stroke. And here's why. It can lead to damage in the blood vessels in the brain. This damage can create blockages or cause blood vessels to rupture, both of which can lead to a stroke. And it's not always silent. High blood pressure often comes with common symptoms like headaches, dizziness, and nosebleeds. So, when you notice these symptoms, don't just brush them off. High blood pressure can lead to damage in the blood vessels in the brain. It is a sign you should never ignore. Number 2. Fatigue. This is often overlooked as a warning sign of a stroke, but it's more significant than you might think. Fatigue can stem from numerous factors like stress, poor diet, or lack of sleep. It can be a predictor of a stroke due to its association with cardiovascular conditions, sleep disorders, and chronic inflammation. Conditions such as heart disease and high blood pressure, which manifest as fatigue, increase stroke risk. Sleep disorders like sleep apnea also contribute to this risk by causing intermittent oxygen deprivation and elevated blood pressure. Additionally, chronic inflammation linked to fatigue can damage blood vessels, promoting plaque formation and clotting. Number 3. Vision problems. These are not just inconveniences, but could be your body's way of signaling a potential stroke. Common symptoms include blurred vision, double vision, or even loss of vision. These issues can indicate a disruption in the blood flow to the brain, so if you're experiencing any changes in your vision, don't dismiss them. Number 4. Sudden headaches. These aren't your everyday headaches caused by tension, migraines, or sinusitis. We're talking about headaches that seem to come out of nowhere and are unusually severe. These sudden headaches could indicate a disruption in blood flow to the brain, potentially signaling an impending stroke. Number 5. Numbness or weakness in your limbs. Ever woken up with a numb arm and shrugged it off as sleeping funny? Well, you might want to pay closer attention next time. Numbness or weakness in your face, arms, or legs is not something to take lightly, especially if it's reoccurring. It could be a sign of damage to the brain. Common symptoms include feelings similar to pinched nerves, arthritis, and carpal tunnel syndrome. Numbness or weakness in the face, arms, or legs can be a serious sign of a stroke. Do not disregard these symptoms. Find our video informative so far? Before we move on to the next sign, don't forget to hit the like button and subscribe to our channel so you never miss out on our daily health videos. Number 6. Difficulty speaking. This can be a sign of an impending stroke. This is because it indicates potential damage to the brain's language center. When the brain's language center is compromised, communication can become a struggle. This is often manifested in stuttering, slurring of speech, or having trouble finding the right words. Number 7. Memory problems. Memory issues are not to be ignored, as they can be a warning sign of a stroke. A disruption of blood flow to the brain, which is a common occurrence in a stroke, can lead to forgetfulness, confusion, and difficulty concentrating. These symptoms can easily be dismissed as a part of normal aging or stress. However, if you notice a sudden or significant increase in forgetfulness or confusion, it's crucial to seek medical advice. Number 8. Loss of balance. This can be a sign of an impending stroke. A disruption to the brain's coordination center may cause this loss of balance. Inner ear problems, muscle weakness, and certain medication side effects are common causes. It's as if the world tilts on its axis and you're left grappling for stability. Number 9. Nausea and vomiting. This isn't your typical stomach bug. It's an indication of disrupted blood flow to the brain. The common culprits: food poisoning, Viral infections and even motion sickness can leave you feeling queasy, but it's when these symptoms come unbidden without apparent cause that you should take note. Number 10, chest pain. This can be a warning sign of a stroke. This discomfort can stem from various causes, including a heart attack, angina, and even acid reflux. However, when it comes to strokes, chest pain may indicate a disruption of blood flow to the heart. This irregularity can potentially lead to a stroke, as the brain may subsequently receive less oxygen and nutrients than it requires. Each of these 10 signs, from high blood pressure and fatigue to chest pain, are things to keep an eye on. They're like pieces of a puzzle, each potentially pointing to an underlying issue that could lead to a stroke. While some of these signs may seem common and often have other explanations, their persistence or severity should never be ignored. They could be the body's way of signaling that something isn't quite right. It's essential to remember that these are potential warning signs, not definitive predictors. It's also absolutely vital to manage risk factors such as high blood pressure, smoking, diabetes, high cholesterol, and heart disease. By living a healthy lifestyle and keeping these risk factors in check, you can significantly reduce your chances of having a stroke. If you or someone you know experiences any sudden or severe symptoms, such as difficulty speaking, sudden numbness or weakness in the face, arms or legs, or a severe headache, it's crucial to seek medical attention immediately. Have you or a loved one ever experienced a stroke before? Did you see any signs prior to the stroke? Please share your experiences with us in the comments below. Enjoyed the video? Hit the like button and subscribe to our channel for more informative videos like this one. We provide research-backed health content every day. While you're here, check out our other videos as well. Until next time, stay healthy.